One of the things that very bothersome to women is prolapse. Now, explain to me what prolapse is and how somebody knows they're getting it.
Prolapse is a very common problem. 1 out of every 3 or 4 women in their lifetime will seek help for prolapse. The simplest way to think about it is that things in the pelvic floor, uterus, bladder, floor of the vagina, vaginal walls, begin to drop down, fall out of position. Very often it will be a very surprising or scary thing for a patient because she'll realize that something is clearly out of position or protruding out during a shower, for instance.
My insides are falling out.
Exactly.
So it comes out the vaginal vault, the vaginal outlet?
It sure can. It can be so severe that things completely turn inside out and come all the way out to the outside. Now that's a severe case. For most patients, they begin to have symptoms that bother them when things begin to drop a little bit, but before they get so severe.
Can women tell if something is dropping a little bit and doesn't fall to the outside?
Sometimes they can. Sometimes they'll describe sort of a pulling sensation, a heaviness in the pelvic floor. Sometimes it can have an effect during intimacy. Sometimes they begin to have some bladder symptoms. They're having to go more frequently. They don't feel like they're emptying all the way. They're having some accidents on the way to the bathroom, maybe even some difficulty moving their bowels properly.
How do you make the diagnosis of uterine prolapse?
The way we approach it these days in a female is that we do a very comprehensive, very gentle, brief, but comprehensive pelvic floor exam in the office. This involves taking a series of 9 different measurements in centimeters, if you will. It only takes about 90 seconds. It's more gentle and comfortable than most pelvic exams, but that gives us a very comprehensive look at all of those very crucial parts of that pelvic anatomy that function together as a unit.